Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes with your host, Dr. Rhiannon Winsor. Dr. Winsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes. Welcome back to The Exam Room. Today, Dr. Rhiannon Winsor is joined by Dr. Amy Bhatt, cardiologist, digital health strategist, and Chief Innovation Officer at the American College of Cardiology. In this episode, we explore where healthcare is headed when technology meets empathy. From the early days of telemedicine to the role of wearables, prevention, and patient agency, Dr. Bhatt shares how digital tools can help us move from reactive care to continuous, human-centered health. We'll also talk about what it really means to prescribe time, why heart health is the foundation of longevity, and why the future of digital health may simply be health. Let's step into the exam room.
Today joining me is Dr. Amy Bhatt. She's the Chief Innovation Officer at the American College of Cardiology, a cardiologist, and also a digital health strategist who's helping to design real-world systems that are equitable, scalable, and deeply human-centered. So we have some interesting topics we're going to talk about: when digital meets empathy, how to prevent data overload, how to coach health centers for sustainable innovation, and whatever else we come across along the way. Thank you so much, Dr. Bhatt, for being a guest on our podcast.
Oh my goodness. Thank you for having me. This is such a pleasure.
Awesome. Well, before we dive in, would you mind telling our listeners a little bit more about yourself and why you're so passionate about digital health strategies?
Yes, I would love to. So I am a cardiologist by training. I actually started by doing medicine and pediatrics. I had this idea that I'd be the Norman Rockwell doctor. Like anybody of any age could walk in the office. I'd be able to take care of them. And as I was doing that, I fell in love with this subspecialty of cardiology specifically because around the time that I was training, it gives away how old I am, but kids who had heart disease, like congenital heart disease, blue babies, people with holes in their heart, before my generation, they hadn't actually lived very well into adulthood. But because of all the advances in anesthesia and surgery, when I was training, there was this whole cadre of young adults who had pediatric congenital heart disease. And they were either sitting on these toddler seats in a pediatric cardiologist room, right, at age 26, thinking, why am I here? Or an adult cardiologist said, why is there someone 30 years old in my room? I take care of 70-year-old people with, heart attacks. And so there actually wasn't a group of people trained to take care of adults with pediatric or congenital heart disease. And I had a unique calling in a way because I had trained in medicine and pediatrics and kind of fell in love with that idea that there's this group of young people who were kind of taking the bull by the horns, living life despite, being given a challenge at birth. And so that became my subspecialty. It was awesome. But the reason I mention it in terms of digital health is they also got FaceTime and things. And they were like, can we FaceTime our doctor's visit? And I was like, oh God, I'm going to be fired. Like, this is illegal. And so when they started demanding more access to me, care at home, in the community where they lived, that was the first time I said, okay, there's got to be a system. And I saw some of the earliest versions of telemedicine. They were awful. It was like you could barely hear my voice. Things would crash all the time. But my patients were appreciative. They were like, at least you're trying to not make us drive in 4 hours from Maine to Boston just to have a conversation with you, when honestly, we could do that from the comfort of our own home. And so I always credit my patients for making me think about, how do you get complex care into the communities where people live? And the only way is what we now refer to as digital health, right? Telemedicine, remote monitoring, imaging transfer, digital stethoscopes, all these things that we now have, but then we didn't, and we slowly built it over the past, 10 to 15 years.
Yeah, and so do you see COVID being like one of the catalysts for pushing this digital health forward?
Oh my gosh, the years before COVID. So I started doing telemedicine in 2013, and I tried to convince everybody it was the greatest thing ever, and nobody wanted to do it. I happened to be director of outpatient cardiology at Mass General during COVID. So I'd taken the position. We did about 60,000 visits a year, and we just shut down March of 2020, like no more business. 60,000 people who would be coming in, not coming in. And they said, does anybody know how to do telemedicine? And it was one of those, I'm going to date myself again, but from Dirty Dancing, like nobody puts baby in the corner. It was like one of those moments for me where it was like, wait, I've been doing this and talking to you about it for 7 years. And so there are very few silver linings to COVID, but one was this idea of telecare, getting care in the community where you live, of doing things virtually when they can be done virtually. Really, you're right, was born out of COVID because the system and the infrastructure got better and because the fiscal benefits, right? Like there were companies who couldn't deliver care, and the only way to do that was to do it virtually. And so in a way, we built the infrastructure out of need. Plato says necessity is the mother of invention. And I like to quote myself, it's awkward and trying not to be narcissistic, but desperation is the mother of adoption. It's like the farthest thing from narcissism, right? Which is, I started telemedicine because my patients were like, we're not coming in. I'm 26, I live in Maine. You either come to me or I don't come, right? And so I started from desperation. And COVID got everybody else to start from desperation. Our clinics are closed. If you want care, we're going to have to do it virtually.
It forced us to innovate.
That's right.
So where do you see digital health 5 years from now, 10 years? What do you think it's going to look like?
Yeah, I think it's gone, because the idea that digital health is separate from health is kind of a confabulation, right? In today's day and age, there should be nothing that is analog anymore about healthcare. And so I think we'll stop calling it digital health. It'll just be, how do you get your healthcare? Well, sometimes I'm on video, sometimes I'm on phone, sometimes it's asynchronous and I type my things in. Other times I just talk to my phone and my chatbot from whatever hospital says, how are you doing today? And I give it updates. And every once in a while, when I say I'm kind of short of breath this morning, then my doctor suddenly calls me and says, hey, we looked at your numbers and you need a little more diuretic because you got fluid in your lungs, right? So I think the word digital health is going to be gone in 5 years. It's just health, and the world has changed and the world is digital now.
So let's shift gears. I want to pick your brain about something called prescribing time. Can you speak a little bit to what that means and how maybe digital tools can help with that?
There is a very large movement in longevity that has started a couple years ago, and it's fully here now, which is, I like to think of it not as lifespan, how long you live, but health span. How long can you live well? And this idea kind of comes in different shapes and sizes, right? So for some people, we say it's for the top 1 or 5%, this idea of longevity and what things can I do. But honestly, it's for all of us. How long can I live well? And so I was asked to give a TED talk, and the TED talk was supposed to be in the realm of longevity. And I said, look, the idea is you're asking to prescribe time. You're asking the healthcare industry to create drugs, to give you herbals, to teach you lifestyle changes that make you live longer. And all of that is very true. But at the end of the day, and I'm fully biased and I admit it, cardiovascular disease, heart disease is the number 1 killer of people in the United States, and actually worldwide if you don't count infections, right? And it's preventable. Period. It is the number 1 killer of people, and it's preventable. So the best way to get longevity, right? The best way to prescribe yourself time is to pay attention to your heart health. And the way we deal with heart health now is, I had a heart attack and now I'm being treated, rather than I know all the things that can cause this, so I should get on top of it. Put it as like a thing we have to do. Nobody ever does things they have to do. You have to keep your cholesterol down. You have to eat well. You have to. And I think the reframing to me is the most important thing. If you want to live a long, healthy life, then you would choose to eat well the majority of the time. Then you would choose to be more active. Then you would choose to not complain if you get the farthest spot in the parking lot and walk in thinking, okay, those are a couple extra steps I got there. And so I think it's a reframing of like, I want to be healthy for long. I have two daughters, 12 and 18. I want to be around for them as long as I can. End of the parking lot works for me. Like it gets me those steps in. And so I think that's really that prescribing time. Sure, there are going to be drugs. There's never going to be a silver bullet that maybe make you less inflammatory, maybe make you do this, right? But at the end of the day, we know that changing your habits, treating things early, measuring your numbers, those are the things that matter. And so I think it's just a reframing. We can't blame ourselves as individuals and say, you have to do this. Instead, it's, hey, want to have a really good life? Here are a couple of things you could do. And a lot of them are related to heart disease.
Yes, I have a lot of thoughts flying around in my brain right now. One, just geared towards prevention and the importance of that. And in a previous episode, we met with a physician, and prevention is his passion. He's a primary care physician. And he said, people are looking for a cure for cancer and they're upset that we don't have one. Well, colon cancer he was speaking to specifically, and he said, we do. It's called a colonoscopy. Like, get your preventive screenings, come in for your annual wellness visits, those kinds of things, because catching things early, right, is the best way to be able to care for whatever is going on. And also making those lifestyle changes, like you said, choosing depending on maybe how much time you want.
This is exactly it. And part of what we're getting to now, and the reason I say digital health won't exist in 5 years, it'll just be health, is the annual visit really a thing? Is the annual screening? Yes, colonoscopy screening, mammography, get your labs. But is the annual visit for blood pressure appropriate? It's absolutely not. That's poor healthcare. Get your blood pressure checked once a year with a doctor. That's not reflective of anything. And so I think the other thing about what we're still going to call digital health for now, because it's not gone yet, right, is measure your blood pressure at home. Measure it frequently. If you're not measuring the actual blood pressure, get one of those wrist things that tell you roughly, do you might maybe have a blood pressure problem or not, because they're pretty darn good, even if they're not telling you an exact number, right? And so I think this idea of wearables becoming healthcare is really important, because it's not right for either the clinicians or the patients to say the clinician is responsible for an individual's health. It's not true. An individual is responsible for their own health. And if they're not activated, we can't help them no matter how much you want to. And so how do you activate individuals? And that's where things like wearables come in. Give me my own data. Show me my baseline, because whatever the largest trial is, which by the way, never gets to the average human anyway, but whatever the largest trial is, that's on me. But if you take me for 3 months and you get my blood pressure pretty regularly, doesn't even matter if I skip a day, it's still more continuous than twice a year. I know what my baseline is. And then I know when I'm off my baseline. And now I'm activated to do something about it, right? And I'm educating people, hey, when your blood pressure is high, there's a stroke risk. And I think, oh God, no, I don't want to have a stroke. I personally don't want it. My family doesn't deserve it. And all of a sudden, all these things start to become real. And so I really do think that that's where the continuous care, the wearables, they're moving towards being healthcare, because we can't do population health one doctor to one patient at a time. That's not going to work moving forward. We have more patients, fewer doctors. People have to have their own numbers. They have to know when they're out of range. And then we need a system to say, okay, you're out of range, now you come, and we figure out what to do.
Yes. I was surprised the other day when my watch told me that my heart recovery rate, it has been quicker or higher over the last 7 weeks than it had over the previous, span of time. And I was like, what is that even about? So then I read about it. I was like, oh, okay, that's a good thing, right?
So that's the thing, right? And you wouldn't know, because, so here's where I'm getting to. Oh my gosh, I love that you said this, which is, if you have a wearable like that and the number changes, you think, oh my God, my number has gone up. Is that bad? Until one reads about it and realizes, oh, a faster heart rate recovery is great. It means I'm in good shape. And so I think one thing we need to do is we need to stop saying like taking care of yourself and wellness is different than healthcare. Like it's not actually true, right? There is a continuum of taking care of your health. So I think the word wellness, I love the word wellness because it means you're trying to be well. But at the same point, I think it's awkward because it suggests that it doesn't deserve treatment or healthcare. And so I kind of think of all of it as just the word health. It's not wellness over here, health delivery over here. It's just all of it is our health, from when I don't have a disease to when I'm measuring things to when I may develop a disease to when I avoid developing a disease. It's all on a spectrum. And so if we could educate people about their wearables, not just from the company who sells it, because it sometimes feels like sales, right? Hey, this is what heart rate recovery means. This is what this means. And then do it in a way that doesn't seem academic and like super educational, right? Like, here's a little video, here's a TikTok on it. I don't care how you get the information across. Just tell people like what they're measuring. I just think there's so much patient agency to be had. And we keep calling it consumerism, and it frustrates me because that implies that it's like buying new jewelry, and it's not. It's not consumerism, it's patient agency. And we should help patients understand what they're measuring and encourage them to do it more.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.